Chapter 4, Health of the Individual, Family, and Community. Just like I've said, you need to memorize the 4 aims of nursing. You also need to remember the 3 major groups that nurses care for, and they are individuals, families, and communities. The first half of this PowerPoint, we're going to be talking about the individual, and then we'll move into covering information about family, and then on to community. Individual health, a definition. To care for the individual, nurses must understand that patients are unique. To provide individualized care, nurses must understand the concepts of individuality, holism, and homeostasis. Definition, concept of individuality. Dimensions of individuality include 3 areas. That of total character, and this is behaviors, emotional state, attitudes, and values of the human being. Self-identity. This is our perception of ourself and how we relate to others. Perceptions, how a person interprets their environment and reacts to it. So again, to understand individual health, it has 3 components, and that is the concept of individuality, the concept of holism, and the concept of homeostasis. So the concept of holism, this is living organisms are seen as an interacting, unified whole that is more than the mere sum of its parts. So we must keep the whole person in mind and be aware of their emotional and their spiritual needs. We can't just treat the disease that the patient has, because that disease is going to affect all of the other dimensions of that person's life, which we've studied in other chapters. It's going to affect how they fit in their family. It's going to affect their job, spirituality, emotional health. So we don't want to just treat the physical dimension of the human being. The third component of individual health is homeostasis. So the concept of homeostasis is the tendency of the body to maintain a state of equilibrium while also continually changing. And there are 2 types of homeostasis that we want to make you aware of. And that is the physiologic homeostasis and the psychologic homeostasis. So first, let's look at physiologic homeostasis. And this is the internal environment remains relatively stable regardless of external environment. For example, our temperature, even though we might be outside in colder weather or we might be outside in hotter weather, our body tries to regulate our temperature through peripheral blood vessel constriction or dilation. So its homeostatic mechanisms are therefore compensatory. Psychologic homeostasis refers to the emotional or the psychologic balance or a state of mental well-being. We each have a basic need for love, security, and self-esteem. On this slide, we are still talking about the psychologic homeostasis and how do we meet basic human needs. People's behaviors, feelings about their self, others, their environment, what values do they have, what do they place as a priority in their life, all of these things relate to that psychologic and psychosocial needs that we have as human beings. And these basic human needs are common to all of us. Meeting these needs are essential for the health and survival of all people. So a person can meet some of these needs individually, but many of these needs require relationships with others, interactions with others for either a partial or complete fulfillment of that basic human need. And satisfying one's needs often depends on physical and social environment, especially in one's family and community. So, it's really important to remember that when a patient's in a hospital, that they truly do need the support of their family. It fulfills that basic human need that all of us have. So when nurses tend to try to, get annoyed with the family, don't want to have to mess with the family in the hospital, remember that the family to that patient is the most important part of who they are and meeting these basic human needs. The next several slides, we're going to talk a lot about Maslow's hierarchy of needs. And it's important to remember that this is a very important concept to nursing. In fact, many of your nursing questions use Maslow's hierarchy of need to answer them. So if you memorize, which you absolutely should memorize Maslow's hierarchy of need, because you can apply it to many of the questions that you will answer both in this class, in other classes, and on your NCLEX exam. It is a theory that is interwoven throughout nursing. So those levels actually do need to be memorized by you. So first of all, some of the concepts related to Maslow's. The lack of fulfillment in one of these basic human need areas will result in illness. So if you take the very first stage of Maslow's, which is our very, very basic human needs for food and water and shelter, well, we know if we do not have those basic human needs, illness will result. If you're sleeping outside in the elements, if you do not have good food and water to consume, it will lead to illness. So then the flip side is true. If these levels are met, we can help prevent illness. Meeting basic human needs restores health. If we have someone we're caring for that is a homeless person, let's say, and they are diabetic, they cannot afford to purchase their insulin, they cannot afford to have good food to eat, and they're living on the street. They're not going to be able to maintain their illness if we cannot get them a place to live, help them find common things that we all need: housing, food, and water. So fulfillment of basic needs takes priority over other satisfactions when unmet. So again, when you're answering those nursing NCLEX type questions and you have a scenario that's kind of explained in the question, and this is a scenario about someone who doesn't have one of the lower basic human needs met, like food and water, and we'll talk about some of the other areas when I get to that slide, then you can't have fulfillment in the highest level of self-actualization because their basic human needs aren't even being met. So a person feels something is missing when one of these needs aren't met, and then a person feels satisfaction when a need is met. The individual's basic human needs. Maslow's hierarchy is useful to help us understand relationships of disease and for establishing priorities on what we should do as nurses, both first, second, and third. So the hierarchy is based on the theory that something is a basic need if it has the following characteristics. Its absence results in an illness. So if we don't have it, it's going to cause illness in the patient. Its presence helps prevent illness or signals health. If meeting this need restores health, then it's a basic need. It's preferred over other satisfactions when unmet. So again, if we need housing and water, that's going to be more important than reaching a level of self-actualization. One feels something is missing when the need is unmet, and one feels satisfaction when the need is met. So there are 5 basic need levels within Maslow's hierarchy of need, and all needs are present all the time, and people tend to meet the basic needs first before they go up the pyramid and try to meet the next level of needs. So at the most basic level, level 1, that is our physiologic needs, our need for water, food, shelter. Level 2 would be safety and security needs. And that's feeling safe within our environment. Level 3, love and belonging. We want to feel like we are loved, that we belong to a family, a church group, an organization that we feel strongly about, some group in our community. Those belonging needs are fulfilled when we establish that relationship with others. Level 4 would be our self-esteem needs. How do we feel about ourselves as a human being? And how do we feel about the contributions that we make, about improving lives of ourselves and others? Level 5 would be self-actualization needs. And this is the highest level in Maslow's hierarchy of needs. And many, many people do not reach level 5. Level 5 is a level that almost transcends everyday feelings. It's a concept that's a little bit harder to understand, but self-actualization is when you can really look outside of yourself and you want to give to others. You want to volunteer. You want to help others. You accept people for who they are and where they are at in the moment. Maybe you're someone who likes to volunteer to go on mission trips. You volunteer to build a home for a family. You donate not only your finances, but you donate your time and your care and your love. And that level of self-actualization is harder to meet. But when people are able to get to that level, they feel an extreme sense of peace within themselves. Here's the pyramid that helps us to understand how we must meet each level. So at the very bottom of the pyramid would be those basic needs. And you would progress up the pyramid until you reach the highest peak. So we move from physiologic needs to safety and security, love and belonging, self-esteem, and self-actualization. We're going to take about a slide for each of these levels and talk about them in a little bit more detail. There was a YouTube video on the previous screen and one on this screen, and I try to make all my YouTube videos pretty short because I know you guys got a lot of stuff to do, but I would encourage you to click on each of these and watch them. I think they help explain this concept pretty well. This is a slide that gives you an example of a type of question that you might be asked on either this exam or later on an NCLEX exam. Question: a nurse who focuses attention on the strengths and abilities of patients rather than their problems is helping them to achieve which of Maslow's basic human needs? So think about that for a minute and then move to the next slide. The correct answer is A, self-actualization. And here's the rationale. To meet patient self-actualization needs, Nurses provide a sense of direction and hope and maximize patient potential. Self-esteem needs are met by respecting patient values and beliefs and setting attainable goals for them. Love and belonging needs are met by including family and friends and establishing caring relationships with patients. Safety and security needs are met by encouraging spiritual practices and independent decision making. Physiologic needs are needs that must be met to maintain life. So again, the very basic level 1 need within Maslow's hierarchy of need would be the physiologic needs. It is the most essential to life, and it is the highest of priority. So remember, if there is a question in your nursing exams, on your NCLEX exam, and the patient is missing the basic physiological needs, then you must choose that because it is the most important one of the levels. Without it, you do not require the other levels. You won't reach those other levels. So things like oxygen, and we know this from our ABCs, right? So if it's an NCLEX type question where there's concern over whether the patient's going to have an airway, well, the most important thing is to deal with the oxygen, is to deal with the airway. If we don't have an airway, nothing else matters. Then we have a need for water, for food, elimination. We have to have a temperature that we can live at. Our sexuality, our physical activity, and our rest. So all of these fit within our basic physiologic needs. So remember the other chapter that we talked about, which was rest and sleep. And sometimes as nurses, I think we don't always remember how important rest is for our patients, because we kind of get in the habit of doing things on our convenience. Is it convenient for us? And we sometimes don't remember that rest and sleep is a basic physiologic need. And if we do not allow our patients to get that rest, then they are not going to be able to heal and to get better. If, as a nurse, we're not reminding our patients to drink enough liquid, then they're going to become extremely dehydrated and can go into renal failure. I've shared with you before that my mother-in-law has dementia and Alzheimer's. She will forget to drink and she will forget to eat. And I think, like I said before, sometimes in the hospital environment, also very much in a long-term care environment, we have so many tasks that we have to do that sometimes we simply forget that we've got to remind our patients to drink and to give them water. Say, hey, take a drink of water for me. Or, oh my goodness, you didn't eat your lunch today. I really want to make sure that you eat your dinner tonight. And remembering that without these basic needs, your patient will become ill and they will not be able to survive. So try to not get so bogged down in the tasks of nursing, which are also important. I'm not saying those aren't important, but getting so caught up in those that we forget just the basic human elements of living. We now come to the second level of Maslow's hierarchy of need, and that is safety and security. It's the second in priority, and it has both a physical and an emotional component. So we're going to first look at this slide to talk about the physical component of it. And that can look a variety of ways. We can kind of think of a variety of things. First of all, where do you live in the environment? Are you exposed to hazardous pollution, chemicals, things like that? Or are you even being exposed to physical violence? And, you know, here in Indianapolis, we're having a lot more murders take place, drive-by shootings. And if you live in an environment which is unsafe, it will be difficult for you or your patient to reach that next level in Maslow's hierarchy of need. We can also apply this to the hospital setting itself. And how do we keep our patients physically safe and protected from actual harm? So some of the interventions that we might use, and hopefully we always use this first one, and that is proper hand hygiene. We want to wash our hands before we go into your patient's room, when we remove our gloves, and when we exit your patient's room. And this is because we don't want to spread infection. We don't want to spread, let's say you've changed your patient's Depends or adult undergarment and they've had a bowel movement. Yes, you've got gloves on and you clean the patient up, and then you take the gloves off and then you adjust their blankets or you pull their side rail up before you've used hand hygiene. Well, now you've probably, because we know gloves are not 100% impermeable to everything, so you've spread germs now in the patient's environment. So that patient could grab their side rail, rub their eye, and get an E. coli eye infection. So again, preventing harm to our patients in the hospital environment is very important. Other examples of this would be making sure electrical equipment is properly grounded and is used properly. Make sure that we are administering medications in a knowledgeable manner and that we are taking time to make sure that these medications are both for this patient, that they are being given in a safe dose, that they're not having interactions. And of course, all of that you'll learn once you get into pharmacology. But again, maintaining a safe environment, we have to try to keep our patients from falling, because if they fall, they've now injured themselves. They've maybe gotten a head injury, they've broken their hip because they have fallen, and now this could lead to ultimate death or loss of function for them. We're still talking about safety and security, but we're talking about the other part of safety and security now, and that is emotional safety and security. And this involves trusting others and being free of fear, anxiety, and apprehension, which is sometimes hard for patients to do in a hospital. They're worried they're going to get diagnosed with an illness that could cost them their life. They're afraid of a procedure. They're fearful that they're going to be in pain. So as a nurse, there are many interventions that we can do to ensure emotional needs are met. And this little list here is by all means not inclusive of everything that we can do to help maintain an individual's emotional safety and security. But things like encouraging spiritual practice. So, we're going to also talk about cultural diversity. And when we talk about different religious practices, well, they may be different than your own. But remember, in nursing, it's not about what you want, it's about what your patient needs. So if they need to have their spiritual practice assisted by you in order to meet that need, then we need to try to help them as much as we can. We need to ask our pastoral department or spiritual health department to come and see the patient. And we also want to allow as much independence as we can in the decision-making process. And let that patient have that control when we are able to do that. I know this is one of the things that upset my dad so much. He has always been this very strong man. He was in the Navy during World War II. He built houses and did construction his whole life. He had his own business. So he was a very strong, independent man. And just because he was 90 years old or 91 years old, it didn't mean that he was confused and disoriented, but people would try when he was in the hospital, when he was in long-term care facilities, to just boss him around. And it would make him so angry that he didn't feel like he was getting that emotional respect, and that he was not being allowed to make some of the decisions that he most certainly could have been able to make for himself. Um, does he want to take a bath now, or does he want to wait and take a bath later in the day? What does he want to eat? When does he want to eat? And I get it that it can be hard when you've got multiple people wanting to do things at different times. But when you take away that ability to make choices, then you're taking away that emotional security for that person. And it can be quite devastating for them. So another thing that we can do is carefully explain anything new or unfamiliar to our patients. When we're getting ready to do a procedure on them, let them know what level of comfort or discomfort they may experience. I'm not saying you have to say, oh my God, this is going to be the most painful thing you've ever seen, because of course we want to try to minimize the pain that someone is going to experience, and we're going to do what we can to make it as painless as possible. But some things do hurt, right? But we can medicate with pain. We can be as gentle as we can. Sometimes I'll have someone ask me when I'm getting ready to put a Foley catheter in someone's bladder, is this going to hurt? Well, I try to be honest with them and say, it is somewhat uncomfortable, but it shouldn't be so unbearable that it shouldn't hurt that much. And if it does, by all means, tell me while the procedure is taking place, and I will try to, implement something that maybe would make it less painful for you. And for example, if putting a Foley catheter in someone, we do have numbing gel that we can use if for that individual it is extremely painful for them. So we can always think about how can we do things for individuals to alleviate their fear. They're getting ready to go down for a scary procedure. Using therapeutic touch. Placing a hand on their shoulder and smiling at them and reassuring them that you're going to be there for them. And this goes a long way in helping with their emotional safety and security needs. Third level of Maslow's hierarchy of need is love and belonging. And it's typically called one of the higher level needs. That is, if we do not meet our physiologic and our safety needs, we are probably not going to get to this higher level need. And this is really understanding and the acceptance of others in both giving and receiving of love. The feeling of belonging to groups such as our family group, peers, friends, our neighborhood, our community, and feeling like that you just belong, that people know you where you're at. And I have a restaurant that I go to, and I go there frequently. I absolutely love Mexican food. So we go to El Rodeo. And there's actually one that's a little bit closer to our house, but we drive just a tad bit farther to get to the one that we actually like better. They have had the same staff for a very long time. All of the servers, the managers, they all know us because we are in there once a week at least, sometimes twice a week. And it's so nice to go in there because they come over and they talk to us. They want to know what we've been up to, and we ask them about their families and what they're doing. It's just nice to feel like you belong, and that people know you when you go to your favorite restaurant. Unmet needs produce loneliness and isolation. So when we don't feel like we belong in a family, we don't have a family, we don't have friends, we don't know our neighbors, we don't participate in community events, then we can become a very lonely and isolated person. So think about people who have to live in long-term care facilities. where they just sit there for days in, days out. No one comes to visit them. They're not participating in any of the activities within the facility, and they're going to feel very lonely. They're going to feel like they're not a productive member. They bring nothing to those around them, and it makes them feel extremely depressed and isolated. My dad had been such a involved person his whole life. He had lots of friends. He always knew his neighbors. He was very involved in his family. And when he got to the place where he couldn't get out of the house, he became very, very lonely. Even though, people would still visit him, but he would still, many hours a day, really not be up and doing things because he was too debilitated to do that anymore. And it really very much made him feel isolated, lonely, and depressed. And he would say things like, I don't know why God's still letting me live. I really want to die. I want to go be with your mother in heaven. So for him, he lost his partner in life, the most important person to him. And because of that, he no longer had that strong sense of belonging to another human being and to his wife. Of course, he still had the remainder of his family, but that most important relationship with his significant other, which was my mother, was gone for him. And he really felt incredibly isolated and lonely because of that, and prayed to God to allow him to pass so that he could go and be with her. So this affected him greatly in the last couple of years of his life. So examples of how we can have interventions to meet this need of love and belonging. And this is including family and friends in the care of your patient, which is very important. If someone is visiting friends, family, let's say it's like for me, I know when my mother was quite ill, many of the nurses that cared for my mother were very good about including me in the care of my mother, because I stayed with her for 6 weeks in the hospital. I stayed 24 hours a day and only left a few times in that 6-week period of time. So the staff, most of the staff knew that, when they came in, I could be at the bedside. That's what my mother wanted. She was still alert and oriented and able to confirm that. So they didn't ask me to leave when they were doing certain things. They included me in that care. The doctors came in and we talked, my mother and I talked to the doctors as a unit. And that was really important to her, very important to her. And it was very important to me as well. Another intervention would be to establish a good trusting nurse-patient relationship. And how you do that is you do what you say you're going to do. So sometimes nurses tend to not say what they're going to do because they don't want to be held to that standard. But that does nothing but make your patient distrust you. So just simple things, you guys, like saying to your patient, oh, I'll be back to check on you in a few minutes. Well, and then of course you might get called into another patient's room. You might be an hour before you can get back in there. So don't say things like that. Say things like, I have to go check on another one of my patients, and then when I get done with that, I'll be back in. It'll probably take me about 10 to 15 minutes to do that. So overestimate. Don't say, I'll be back in a couple of minutes, when you know very well it's going to take you about 10 minutes to get in there. A couple of minutes to your patient does not mean 10 minutes to them. They're very literal. So give them realistic expectations. Acknowledging their pain, saying, I can see that you're in pain. I'm going to do what I can as your nurse today. We're going to work together to try to get your pain down to a tolerable level, and then following through with that. Another example would be, let's say the patient is going to be discharged, and the doctor comes in that morning and says, okay, well, you're discharged. I'm going to go write the order for you to be discharged. And then the patient, however, they don't understand that when they're discharged, that there are a whole lot of things that have to be done before they actually leave the door. And that process takes approximately 2 hours. So it's so important that when you know a patient's going to be discharged, even if the doctor hasn't written the order yet, we as nurses know that, okay, they're probably going to go home today. So that morning, have a conversation with them before the doctor even comes in, and just say something like, hey, I know, there is a chance that you might get to go home today, but I just want to let you know that when your doctor comes in and says to you, hey, I'm going to go write an order for you to go home, I just want you to know that all the stuff that happens behind the scene is going to take a couple of hours for us to get done before you can actually go out the door. So things like, we've got to work with pharmacy to make sure your medications that you're going home on, we have to make sure that you have those prescriptions done. We have to make sure that case management comes in and sees you, because we've got to get you some equipment ordered for you to go home, and all that's got to be scheduled. I also know that you're wanting to, we may have to transfer you home in a wheelchair van, so we've got to get that ordered, or whatever it is for that particular patient that's going to need to be done. Kind of set the expectation of how long that might take, because when I'm going to tell you, I've done this a long time, guys, and when a doctor goes in and says to that patient, well, I'm going to go write the order for you to go home, they immediately pick up the phone, they call their loved one, and they say, the doctor said I can go home now, so you need to get up here and pick me up. And guess what? The family comes and the patient's ready to go, and now they're waiting 2 or 3 hours to get out. They are furious and they get so angry. And if you can prevent that from happening, it's going to make your life a whole lot better. So this is an example of establishing a trusting relationship with your patient, always letting them know what's going on. What are you doing? What are you checking on? If you say, let me go check on that, then follow up with them and go back and tell them what you found out. Don't just leave them stranded. This is how you establish that good, trusting relationship with your patient. And I will tell you, it will make your life a whole lot easier. The next level in Maslow's hierarchy of need would be the 4th level, again, a higher level need. This is self-esteem needs. And this is the need for a person to feel good about themselves, a sense of pride, a sense of accomplishment, to believe that others also respect them and appreciate what they bring to the world. And a positive self-esteem facilitates a person's confidence and independence. So it's not uncommon when patients begin to age for them to have a lot of struggles in this level, because they're not able to do the things they used to do. So that sense of pride and accomplishment begins to diminish. So as a nurse, one of the things that we can do is talk to them about their past. What are some of the things you did? What kind of work did you do? Tell me about your family. Oh, do you have grandkids now? Oh my goodness, how many do you have? And acknowledging that they are still an important member of society. They have the wisdom that they can impart to others. And this is really hard for many patients when they lose their ability to be functional. Having things in long-term care, having things in their room that reminds them of the person they are and the accomplishments that they have made. And again, asking your patient, giving your patients choices. I know that was in the previous emotional security side, but asking them, hey, would you like to take your bath now or later? That also helps in this area of development because you are respecting them and you are respecting their wishes. So factors that affect self-esteem would be role changes. When you've had an individual who has been the primary breadwinner in the family financially, and they have an injury where they are no longer able to work. So this can affect someone's self-esteem very negatively. So one of the things that we could do is to try to think of things that would help this person to still give back, to still feel a sense of accomplishment, but maybe not in the same way. Body image changes can also affect our self-esteem. We feel as though we are disfigured in some way, maybe through an automobile accident, maybe through being a diabetic, a limb has been amputated. Some of our military veterans, where they've lost both of their legs, how do we help them feel a sense of pride and accomplishment? How do we help them to be independent again and accept that their body has changed, but that they are still able to contribute to society? So this is definitely an area that is a higher level need that, yes, in the hospital environment, certainly we can begin to work on this, but this is also going to have to be done outside the hospital environment, within our community. You know, a lot of us know people who we call shut-ins, who are elderly and not able to get out of their homes. You know, if we just go and visit once a month, once every couple of weeks, pick up the phone and call a loved one or a family member that maybe you haven't talked to in a while, you won't believe how much and how important that is for them and how much this helps their self-esteem. Our last Maslow's hierarchy of need is all the way at the point of the pyramid, and this is self-actualization. This is that level of need where you almost kind of transcend everyday life. This is being able to accept yourself and others as they are, where they are in that moment. It's being able to be accepting and embrace differences. It's not only about being tolerant of differences, it's about fully accepting and embracing differences in people and appreciating people for who they are and what they bring to our society, even though you may not fully understand their life. We're going to be covering cultural diversity, and I'm hoping that when I do that lecture, the point of it is to try to help you start seeing things differently and being more accepting of people who are different than yourself. And this is how you reach that level of self-actualization, which not everyone gets to. So your focus of interest on problems outside of yourself. So it's not just being so self-absorbed within yourself. It's now being able to look outside of yourself. Look in our community. How can we help others within our community? How can we help people across the globe and get involved in doing things to actively try to make a difference in the lives of others? It's our ability to be objective, feelings of happiness and affection for others, respect for all people, whether you, like I said, understand. It's a truly an embracing of, I don't have to agree. I don't have to understand, but I can respect everyone for who they are in that moment and I can love them. The ability to discriminate between good and evil. You're able to have a good moral compass. Your values about how you treat others in a positive way affects your self-actualization. Creativity is also seen in this level of need. Being able to be creative and solve problems, pursue your interests, to have the ability to, again, make a difference in others. Philanthropy is one of those terms where you reach the ability to just give towards others. And this can be a hard level because in our lives we get kind of busy and we get kind of caught up in our own lives and in the things that we do. And sometimes it's hard to reach this self-actualization stage. My neighbor, Maxine, that's going to come and visit our classroom, she is someone that has definitely reached the level of self-actualization. And when you talk to her, you're going to see several things that she does, which is completely outside of herself because she does a lot of volunteering and helping others. We're going to move on from talking about the individual and start talking about the family. But before we do, I have a question for you about Maslow's. Which patient need has the highest priority? So look over those answers and go to the next slide for the answer. Answer A, a person who needs to ambulate to prevent DVT. And the rationale is preventing DVT is a physiologic need and is the highest priority need. A patient in isolation might have unmet love and belonging needs, which is a third priority. A patient who lost a spouse might have an unmet self-esteem or love and belonging need, and that would be the third or fourth priority. A patient who is at risk for falls might have an unmet safety and security need, which is the second priority. So a person who needs to ambulate to prevent a DVT would be the highest priority for this patient, preventing a physiological problem. So this might be an example of a test question that you could see. So this is how we would have you apply Maslow's hierarchy of need to an actual test question. So we move into family structures. And the family definition is any group of people who live together and depend on one another for physical, emotional, and financial support. So this is very broad, isn't it? Any group of people who live together and depend on one another for physical, emotional, and financial support. So it doesn't have to be the traditional family of a mom, a dad, and two kids. It can be, which is your nuclear family, by the way, which is the next definition. It can be any type of a family. A family can be a group of friends who live together. I don't know if any of you or many of you have watched, or I mean, it was a pretty popular show, but the show Friends. And this was about 6 people who lived, and I can't remember if they live in New York or Boston or wherever it was, I don't remember. But they were really a family. They provided emotional support. They really provided financial support for one another because they would split the rent. They would provide physical support for one another. They loved one another. They were really a family, the 6 of them. Extended family, the definition would be, things like your aunts, your uncles, your grandparents. This would be your extended family. Blended family is 2 parents and their unrelated children from a previous relationship. So this is when you have parents who have divorced, they have children from a previous relationship or separated, they may not have even been married, and they now marry someone else, and they bring these 2 families together, and now they are blended. A single parent family is very much a family. This is when you have one parent, and they may be either separated, divorced, widowed, or never married to begin with. And that is very much a family. What about a, a family who is gay, where both members of the family are both men or women, and they also have children? That is also a family. So many different things we can see could fit the definition of a family. Roles of the family include physical, economic, reproductive, affective, affective, and coping, and socialization. So families fulfill each of these roles. We physically care for each other. We financially, economically care for each other. Family roles can be reproductive, but they don't necessarily have to be. Adoption can also be something that causes the family to enlarge. And our families help us to cope with life and to feel emotionally attached to others. And they also help socialize us. They help teach us how we should behave in our world, in our community, in our family. They teach us our cultural beliefs. They teach us our values and our morals. So, socialization role of the family encompasses some of those other things like, oh, we don't tell lies, or nope, you can't steal, don't throw your paper on the floor, you need to put that in the trash. All of these things that we teach our kids and we really don't even realize that we're doing it. I don't know if any of you have taken the class on family development. It's a sociology class. And if you have, you kind of know what I'm talking about. If you haven't, this might be new to you. But there are certain stages within the family that we see, and certain milestones that families go through, just like individuals go through developmental milestones, families go through developmental milestones. So some of the stages of a family might be a couple and family with children. So just a couple where they don't have children, or a family that has children, a family with adolescents or young adults, family with middle-aged adults, a family with older adults. I have always been one of the kind of oddball examples of this because I have spaced my children so far apart. My husband and I got married younger, so of course we were just a couple with no children. Then we had our first child at 22. I was 22 when we had our first child. We didn't have any more children until I was 32. So our first son was already in, I think, the 5th grade when we decided to have our second child. So then we had a baby again. Well, after my second child turned 10 years old, then we adopted our daughter. So we had a baby again. So at this point, my oldest son was a young adult. So we were a family with an adolescent and a young adult. So, but now I'm also a family with a baby. I'm definitely, right now, my husband and I are middle-aged adults, but we still have children living in our home. So we still have a teenager living in our home. And we are also caring, or were, for me, both my parents have just recently passed, and for me just not too long ago for my dad and a few years ago for my mom, but my husband's mother is still requiring help. So we're a middle-aged family with a teenager and also caring for our parents. So all of this is, so we've got parts of our family that you will see in a variety of stages of families. Then you also have families with older adults and caring for maybe still children. You may be an older adult and you're now raising your grandchildren because something happened with your child that is either they're not at a place in their lives where they can care for their children, or they've had an illness or death, and now you are raising your grandchildren. So this puts you in a completely different stage of family. So the only reason, the reason I have this slide here is because I want you to think about your own family. Think about other families that you have seen. And, families can be in a variety of stages. So if you have a family that's really kind of in a multiple stages of a family cycle, that can cause them more stress. We don't typically, as older adults, we don't typically raise our grandchildren because we're kind of trying to get to the place where we can retire and slow down, but yet we have a small child still in our house. So this can cause different economic stresses and struggles. So remember that when you're helping your patients and you are looking at their family structure, try to appreciate and understand the extra stress that they may be under because of not progressing through the normal family stages, because other things have happened now where they're going to have to compensate. There can be a variety of risk factors for altered family health. For example, lifestyle risk factors. Some members of the family may be making certain life choices that would be putting the entire family at risk. Psychosocial risk factors. Maybe there's a member of the family who has anger control issues, and they are putting the family at risk. Environmental risk factors. Maybe the environment in which the family lives is putting the family at risk. Developmental risk factors. And this is kind of an example of what I talked about in the previous slide, being in different stages of the family, but all at the same time. You're trying to be in, let's say for my husband and I, the middle adult age stage of the family, but my mother-in-law, for example, lived with us for almost a couple of years, but her dementia and Alzheimer's has gotten to the point that we've had to move her to a long-term care facility. And we were helping to care for her while my daughter was still a fairly young teenager and still not able to drive, and I was, needing to take her places. So different developmental things. Also, when a child is born to the family that's going to have some disabilities and is not going to allow the family, or the child is not going to develop at a normal developmental rate. And that is going to put extra stress on the family unit. And then, of course, biological risks. And that can be anything from medical risk issues, changes in the role of the family because of biological risks, is going to cause additional stress on the family unit. The first part of the nursing process is assessment. So in order for us to help a family, we have to thoroughly assess what's going on with the family. We have to know what's going on, right? So assessing the health of the family, the purpose is to determine the level of family functioning. How do we do that? A couple of ways. Health appraisal. This includes a health history, a physical assessment of each family member, and a lifestyle assessment of each family member. We look at their health beliefs. It must be assessed so the nurse can understand the client family beliefs. Health beliefs may reflect a lack of information or misinformation. Certain cultures have very different health beliefs than other cultures, and some of those health beliefs may not be for the best of the family or the individual. And I'm not saying that you tell them straight up, say, oh, well, you can't believe that, that's stupid. But instead you can present some alternative information that maybe they hadn't thought of yet. This slide is still talking about how do we assess the health of a family. And the next bullet point is family communication patterns. And this is how effective is family communication. And it can determine the family's ability to function as a cooperative, growth-producing unit. I think we probably all know people who live in a family unit, maybe it's your own family unit, where communication is really not very appropriate, where there's maybe one member of the family who's just a plain bully. They yell, they scream, they disrupt the family unit. They make others in the family feel emotionally unsafe, maybe even physically unsafe. So, in understanding how families communicate is an important part of how do we help them grow and improve. How do families cope? Behavior are behaviors families use to deal with stress, and their coping mechanism. The success of a family largely depends on how well it copes with the stresses that are being thrown at them. And we all know that different families cope in different ways. And you're going to see this very strongly when you start working in a hospital environment. You may have a loved one, a patient may be a loved one of a family. And let's say it was a blended family, for example. And maybe you have half brothers, half sisters, and now this family member is ill. And how well that family copes with this illness is going to determine what you see in a hospital environment. We have had, on many occasions, we have had to call security on family members that are full on screaming and yelling and cussing at one another, even getting into physical altercations with one another because they are not coping with the stress. Families get in a lot of stress, and some families act out in anger, and they're not patient or calm or loving towards one another. They have a basic distrust of one another. You know, when someone in the hospital is about to die, there are inheritance issues that need to be dealt with. There are end-of-life issues that need to be dealt with. Does one family member want to continue treatment, but yet the other family member wants treatment stopped? One family member wants the patient to have a G-tube for feeding because this family member had a stroke and can't swallow, and the other family member says, absolutely not. I don't want their life made any longer because they're going to be miserable. And you've got two family members, maybe a brother and a sister, that are just really arguing this out. And how do we help them? Because as healthcare providers, we must absolutely come to a resolution. And we may have to have the families sit down, have a mediator, sometimes the spiritual health department can come and help. We have representatives within hospitals that can come and mediate and talk to family members individually and together. As nurses, we can talk to family members and try to help them to understand what their options are. Try to intervene and help them to calm down and maintain a safe environment within the hospital. Some of the NANDA nursing diagnoses for families are listed here on this slide. Again, we may or may not have covered, we have covered a little bit of nursing process, but more of that's going to be covered later. But this gives you an idea of what are some of the nursing diagnoses that we can have for families who are maybe not coping well. So remember that when a family is ill or a family member is ill, then they are going to reflect the behaviors that they learned in the family. That's not always true. Some people have more anger control issues than others, even though they may have not been raised that way. They just don't cope with stress individually as well. But many times you will kind of see some of that learned behavior. Illness may precipitate a health crisis in a family. So members of the family may need to adjust to different roles, different responsibilities. They may need to manage the needs of the ill family member. And nursing interventions for families experiencing a health crisis. What do we do? What are some nursing interventions? And we need to be honest, open, and respectful of what's going on within their family. We need to use therapeutic communication techniques. Things like, I can see you're very upset. Can you tell me more about that? Tell me how you're feeling. and apply knowledge of family dynamics and how families work together. We can refer them to community health care and financial resources. And the case managers or the social workers are the ones that are going to be best at knowing what's out in the community for these individuals. Illness of a family member will disrupt the family as members abandon their usual roles and activities. Roles like going to work, home responsibilities, keeping the house clean, going to the grocery, doing laundry, child care needs, who's going to take care of the child if the mother or father is sick, financial needs, how will those get met? Families experiencing anxiety. And families' ability to deal with stress depends on the members themselves' coping abilities. And we may see that one of the family members doesn't manage stress as well as the rest of the family members. And then consequently, what can happen is that particular member can disrupt the entire family structure. Nurses that are truly committed to caring for the family, because remember, we care not only for our patients, but for our families and for the community. And nurses that are truly committed to family-centered care make sure that the patient and each family member understands what's going on. And this photograph in the PowerPoint slide that I have right here, I love that. And I have seen different friends that I have on Facebook post photographs like this when they have a loved one who is extremely ill or that loved one is passing away. And I just think that we've got to remember as nurses, okay, maybe there's allowed two visitors in a room. Okay, you know what? When you've got, it looks like this patient may have had a trach and may just be kind of waking up or getting off the ventilator, to allowing the family members to come and surround them with love. It looks like they've got the family dog there. I mean, what an amazing thing that we can do for our patients. So we can intervene and help families learn to cope better. We can do that through support groups. We can do that through spiritual health visits from pastoral care. We can just do that by simply talking to them and letting them express their emotions. I am going to really try to get through this slide because this slide is very difficult for me now. And that is the death of a family member that you were very close to. I have shared with you, my father just passed away 6 months ago, and my mother was just a few years ago. So when a death of a family member happens, the entire structure of the family is altered. And grief, you not only have grief for the loss in the person, but you very much grieve for the family that once was. And I am very much in the grieving process for not only the loss of my mother and my father, but also for the loss of the family that we once were. So you will go through the stages of grief before normalcy will return and new roles are formed within the family. So if it's a mother and a father and there's still young children in the family, this will affect that family dramatically now. I know when a child in the family is lost and the rest of the family and siblings have to go on and continue to function is extremely hard. So we have to be very understanding with families and let them experience the emotions that they are experiencing. Don't go in and say stupid little comments to them like, oh, it's going to be okay, or oh, I'm so glad that, but they lived a long life. Oh, look at how lucky you were that you had them for so long. I mean, you might think that you're helping, but it's really not helping. So you want to watch those inappropriate communication statements that you could say in a feeble attempt to try to make them feel better. Instead, therapeutic communication would be like, I can see this is very hard for you. I'm so sorry that you're having to go through this. These are things that are therapeutic, not saying comments like, well, at least they lived a long life. Just remember that and always think about what you're going to say. You know, when a patient dies, sometimes I think that we are so unsure about how to provide and show compassion that we just become detached for our own emotional safety. But you really want to be present. You really want to be there for the family. I know that both when my mother passed away and my father passed away, both of the hospitals were so good at, because there were a lot of family members in the room, and bringing in coffee and soda, snacks for us to eat, a container of ice for us to make us something to drink. I think one morning they brought in muffins for us and coffee on a cart. Just those little things that we can do to help a family when they are in the middle of losing someone they love so much can be so therapeutic and kind for that family. Just like all aspects of nursing, there are some theoretical frameworks that we can apply to caring for individuals and families. There are really just three that we're going to talk about in the following 3 slides. First, there is the needs theory, then the developmental stage theory, and the structural functional theory. So each of these you need to remember what they are and how you would you apply them to a test question. First of all, the needs theory. This needs theory state that all people have the same basic needs, but that an individual's needs are shaped by that person's culture or where they live or their environment. It's also useful for promoting the health of individuals. 2 prominent needs theories are ranked on ascending scale according to how essential the needs are. The only one that we're going to really look at is Maslow's hierarchy of need, which we've studied extensively in the earlier slides. So just know that that is a needs theory. And with Maslow's hierarchy of need, in order to be able to answer questions, you're going to have a patient scenario, and then you're going to have to determine, based on priority, which intervention would be the most appropriate for you to make as a nurse. We talked about this one in an earlier slide, and that is developmental stages. And this is, people can go through developmental stages where they have to meet certain behavior or tasks appropriate to that age range. Stage theories also view families as ever-changing and growing units. Families go through developmental stages just as individuals do, and each stage has a problem or a stressor that must be dealt with for you to go to the next stage of development. And I talked about that in earlier slides when you are, like my husband and I, middle-aged adults, but still have a teenager in our family and still caring for elderly parents. So again, that's a stressor, and you have to deal with that in order for the family unit to be healthy. The final theoretical framework that looks at family development would be the structural functional theory. And the focus is on the structure and function of the family. What are the relationships among the members like, and how do they function with each other? I'm not going to, bore you with different types of structural functional theories, just kind of know in general that they are out there. The remainder of our slides will talk about community. And community is a group of people who share some aspect of their lives. Maybe they live in the same location. I live in Fishers, so my community is Fishers. Maybe they go to the same church. I have a church that I go to. Maybe you go to the same school. So even believe it or not, you guys that are sitting in class together, you are also a part of community. You're not only part of the Ivy Tech community, but you're part of the Ivy Tech School of Nursing community. You're also part of the Ivy Tech Nursing community class of, and then whatever year you guys graduate. So we have several different ways we can look at community. Functions of a community. They produce, distribute, and consume goods. So what else does a community do? We socialize, right? That's important. Remember I told you I have the one restaurant that I like to go to because I know people there. I have a couple of friends who opened a brewery in Noblesville, and I like to go there because I know people when they're there, so I can socialize. We belong to a couple of clubs, so I like to go to those because we know people there. And it has some sense of feeling like you belong. Communities can also exert some type of social control. For example, I think well, I mean, it can be positive or negative, but looking at it more from a positive perspective is here in the town of Fishers, they've done a couple of mental health awareness days. And I think that helps the community as a whole to understand mental health better, to try to remove the stigma behind mental health, to help us to understand it more and how can we help with the mental health of our community. Provide mutual support to one another. And I think that's very true. You know, if you belong to, let's say, a church group or a certain organization, you can provide support for one another when you're going through difficult times. And social interparticipation. You know, when you can get together with a community or a group of people and you can socialize, it can be very therapeutic. What is community health nursing? Well, community health nursing tries to promote and preserve the health of populations. Now, it usually is more of an advanced degree role. Typically, we will see bachelor's and master's degree professionals, nursing professionals that work in the community health setting. But for example, you know, some nurses work in the health department. And the health department, they look at the community as a whole and determine, let's say, where do they need to target flu vaccines? Or maybe they need to establish a vaccine program for children because this is a high risk area and they don't have good health insurance. So they might start a vaccination program within that community. So it's a way to nurse different segments of our community. What are some aspects of community health? How do we assess community health? What are some of the priorities that we have for community health? And we've talked before about Healthy People 2020, and it is really kind of an overarching format or program that many of our community health nurses try to implement throughout the different states, because we're saying that the Healthy People 2020, these are areas that we are collecting data on. These are areas that we know there is a deficit in our communities. So another thing, looking at the physical environment in our communities. Do we know that, like I said in the previous slide, a particular community that maybe things are not as safe in that area? Education. Where do we need to do more health education? Safety and transportation. Do we have an area of the community where we have a lot of elderly people that need transportation to get through their doctor's appointments so that they are able to manage their health and illnesses? Politics and government. What type of things are being provided to that community? Health and social services, communication, economics, and recreation. For example, parks. Do we have walking trails that can help people get out of their homes and go for walks on a paved trail so that if they need to use their walker, if they need to use their cane, it's going to be safe for them to do so? Do we have sidewalks in that area? Or is it an area where we see kids being hit by cars because there's not proper sidewalks for them to walk on. So all of these different aspects try to look at community health nursing. You certainly don't have to memorize these nursing diagnoses for communities, but just for you to have a little bit of an idea of what type of nursing diagnoses we might use to apply to community settings. And it would be things like ineffective community coping, ineffective community management of therapeutic regimen, potential for enhanced community coping. These would be some of the things that we might see a nurse who works in this field look at. So guys, a couple of definitions that you need to know the difference between. And the previous slide, we talked about community health nursing. And this slide, we're talking about community-based nursing. So in contrast to community health nursing, which is focused on the whole population within a community, everyone who lives in that community is what community health nursing is. Community-based nursing, on the other hand, is a little bit different. It is centered on the health care of the needs of individuals and families within that community. It must be culturally competent and family-centered. Nurses promote health as individuals, caregivers within an institutional setting. Community-based healthcare providers can also function in that role. Nurses volunteer in health-related activities and as role models for health practice and lifestyles. So nurses need to consider community influences when care planning and making referrals to community agencies. 4 things that can affect community health, and that would be social support systems within that community, community health care structures like hospitals and clinics and resources for them. What are the economic resources for the people who live in that community, and the environmental factors that are affecting that community? Characteristics of community influences the health of each member which live in that community. So for example, if you look at the photograph here, you've got members of a community, and what affects these individual members, what's going on in the community that can affect them. And again, values and beliefs within that community, the healthcare resources, transportation and communication facilities in that community, education, recreational programs can improve the health of individuals in the community. Productions of services and goods, and protection, safety, and aesthetic concerns in the community. All of these things can help the members that live within that location. So we've come to the end of our PowerPoint. Again, this PowerPoint in review, we have talked about the individual and how individuals' health can be affected based on where they are at in their need level. We've talked about family-based nursing, because that is one of the groups of people that we definitely care for, and how when an individual's health is compromised, that will in fact affect the family. And then very briefly, we talked about community nursing, which is of course the other part of the group that we care for as nurses, but that we've kind of talked about how what goes on within a community can really affect those that live in that community. Again, remember to review the definitions, terms and definitions at the beginning of your chapter. Make sure that you understand what those are so that you can answer questions about them.